All right, welcome everyone. We are excited to have Jennifer Gendeman with us today on our second installment of our Ask the Expert interview series. So we have been fortunate enough to work with Jennifer over several years with some of our low vision patients, and she has been terrific and is a huge asset to us. So I'm just going to give you a little bit of information of her background. She received her doctorate in occupational therapy from Washington University in St. Louis, and she received a graduate certificate in low vision rehabilitation for occupational therapists from the University of Alabama, Birmingham. She has a specialty certification in low vision from the American Occupational Therapy Association, and she is a certified low vision specialist. So I hope that I got all of that right, Jennifer.
Absolutely.
You've been working in low vision in Louisville for nearly 9 years, and from personal experience and working with you for some of our low vision patients, you've always gone above and beyond for our patients, and I know you do with your other patients. So thank you for all that you do, and thank you for being on here with us today.
Thanks for having me. Thanks for tuning in, everybody.
Well, I will jump right into questions. We're going to try to keep this short and sweet, but September is Healthy Aging Month. So when we were thinking about people to interview, we kind of started thinking about just the common things that happen as we age, and one of those is just kind of a reduction in vision. A lot of people start to notice as they get older. So as a low vision specialist, is there anything that you can recommend to anyone at any age to kind of help fight or prevent any vision loss?
Sure. Most of the low vision conditions that I work with folks on are, things like macular degeneration and glaucoma, and those have a genetic predisposition. But there are some simple everyday things that you can think about to help, control any vision issues. First one being wearing sunglasses. Sun exposure can, put you at risk for glaucoma, macular degeneration, cataracts, and it's just good practice for us to wear sunglasses when we're outside and protect us from those UV rays, the blue light. Next thing being eat your greens. We always hear about eating carrots for our vision, but our greens can be even more important. Spinach, kale, any of those with the high antioxidants help lower the risk of macular degeneration and cataracts as well. Some other good snacking items that have good vitamin E, vitamin C, things that you need to slow that macular degeneration would be almonds, citruses, and berries. So definitely your diet is a big one. The next being avoid smoking cigarettes. So smoking doubles your risk of macular degeneration, and it can also increase risk with cataracts and optic nerve damage as well. So if you can avoid that, avoid being around it, it will help. And then the last and probably one of the more important ones is exercise or take a walk. Any kind of aerobic exercise can reduce eye pressure that leads to glaucoma. It can improve blood flow to the retina and optic nerve. So with some macular degeneration research, they say that any kind of access exercise, folks saw a benefit. So it doesn't matter how much or what kind, just as long as you increase that heart rate a little bit, get out on a walk. And then with the Glaucoma Research Foundation, they recommend that you do 20 minutes, a minimum of 4 times a week. So there are some different recommendations out there, but get moving.
All right. So overall, just try to maintain a healthy lifestyle and that kind
Absolutely. Kind of simple overall things, but it's good to be talking about it. So it gives you a little reminder, hey, I need to keep my sunglasses in my car and get moving.
Yeah. Yeah. All easy things to get busy in life and kind of put to the back burner.
Sure.
So what advice specifically do you have for older adults, let's say 65 and up? How can they improve their health at their current stage in life?
Sure.
I know
So
there's mobility issues sometimes, but
when I think about just overall health and what I want to be talking to my older adults about when I'm in their homes and we get off the topic of specific low vision things, I always go and look at the America's Health Ranking Senior Report. This is put out by the National Resource Center on Nutrition and Aging. And I really like it because it shows different trends of the different challenges that our seniors are facing. And it looks at the United States as a whole, but then it also breaks it down by state. So I can kind of hone in specifically on what our struggles might be here in Kentucky. And it looks at behaviors of folks, it looks at community resources, it looks at clinical care, access to care, lots of different things that are really helpful. And unfortunately, Kentucky is ranked 49 out of 50 in senior health. So we have a lot of challenges that we face here for our seniors, and 3 of the top ones are volunteerism, just not having a lot of folks out there helping seniors, physical inactivity, which goes back to our first question, and then high prevalence of depression. So, that just makes me remember, hey, I need to mention maybe at commercial breaks, you could stand up and march in place or have a full water bottle near you that you're gonna drink for the day, but also you can lift that's a pound when it's full. So there's lots of different ways exercise can be incorporated or activity can be incorporated. It's gonna look differently for everybody, whether it's getting up at commercials or going to a physical gym for a class. You have to try to establish that routine and make it a part of daily life. So again, we go back to exercise and trying to make that routine for folks and giving them different ideas of how to incorporate it. And then one of the other things I think about and I try to help my folks with is keep learning and trying to embrace technology. I think it's a great way to access information, have social interactions, and that really helps the mental health standpoint. And it, in turn, for my low vision folks, it has a lot of beneficial accessibility features that helps them day to day. So, if you can kind of try to embrace technology or find someone that's savvy to teach you a few things, I think that can be a really helpful piece of life for folks.
Yeah, that's all very good. This next question is probably mirroring kind of the last question, but just for kind of the generation below, the 40 to 65 who are not considered the older adults quite yet, but as they approach that, what are your best tips to kind of maintain, or improve their health at that age?
So I sound like a broken record. Diet and exercise is always important to keep in your brain, and again, turning that into routine. Some of the things that I think about when trying to get started with get moving more or exercising more is either find an activity you enjoy or find a partner that can help motivate you too. So those are just 2 tips to think about when you think, gosh, I just don't know where to start, or I have arthritis or knee pain. So also consulting with your physician or therapist can help you come up with safe activities to be doing. But then next, just knowing your family history. This goes with low vision conditions and beyond. It's important to know what your family has dealt with in the past so that you can be thinking about that, be seeing the appropriate physicians, and be trying to prevent that. Going along with that, the American Academy of Ophthalmology recommends you get a baseline eye exam at least by the time you're 40, even if you have perfect vision, or around the age of 40, because some low vision conditions have no symptoms in the early stages. So it's just really important to get that yearly eye exam specific to low vision. And then also, many of these folks are still working. So keeping on the vision idea is taking that break when you're using electronics and working. And there's the 20/20/20 80-20 rule of eye strain to kind of every 20 minutes, look 20 feet away, take a break for 20 seconds. And again, that's hard to remember. You can set alarms on, your watch, your phone, whatever kind of device you might be using, but just a reminder of that, to take breaks with your vision as well.
Yeah. All right, I like that. I especially like knowing the family history. I mean, someone at 40 potentially still has a parent living who's in that older adult age, and seeing what they're going through, knowing that genetically you may be going through that too at some point. So to go ahead and see the right doctors to try to catch that before it's too late. Yeah, it's good advice. So thank you. So by the age of 65, I've read that 1 in 3 Americans have some form of a vision impairing eye condition. And there were kind of 4 main ones that I was familiar with. So I just kind of wanted to go over those and have you do kind of a breakdown of maybe any early symptoms that people should watch for, any treatment options that you know of, and then any, again, preventative tips. So the 4 that I had, and you're welcome to add more to this or talk about others, but glaucoma.
The 4 that you had are the 4 identified by the World Health Organization as the top low vision conditions, so they're perfect.
Okay, all right. So we have glaucoma, cataracts, macular degeneration, and diabetic retinopathy. And obviously the diabetic retinopathy could happen at any age if someone has type 1 diabetes and is just born with it, but probably more prevalent at older ages just due to the amount of type 2 diabetes as well.
Absolutely. So I'll start with glaucoma because it is one of those that it's important to know that family history because it's known as the silent thief of sight because it doesn't have a lot of symptoms in the beginning. You may not notice that peripheral loss that happens until it's quite severe. And glaucoma is damage to the optic nerve when fluid builds up and causes high pressure in the eye. It damages that peripheral vision or side vision. So folks often have difficulty with mobility or adapting to different light conditions or different glare. But there are surgical procedures to treat that pressure, and there are prescription drops to try to regulate it. So it's important to kind of be tested and looked at each year with that eye exam to see if any of this is coming up. They test your pressure at a complete eye exam, so that's great. Some of the risk factors include just being over 40, African American descent, family history, high blood pressure, migraines, and diabetes. So if you have some of those other things going on, again, extra important to have that yearly eye exam. Next one on your list was cataracts, and that's just when the lens becomes cloudy and makes things hazy, blurry, less colorful. Night vision and driving with headlights can be affected. Light sensitivity may occur. And this is really a normal part of aging and is highly treatable. So I don't see a lot of folks where cataracts is their only issue because they've had them taken out. But again, there's risk factors where family history, diabetes, sun exposure, and smoking, all things we've talked about previously, can kind of bring cataracts on. Next, macular degeneration, probably one of my most popular diagnoses that I work with. It causes damage to the macula, which is part of the retina or the back of the eye. And it's responsible for that fine detail vision. And people with AMD struggle with reading and seeing faces and any fine detail tasks. And there are 5, top risk factors with AMD, and that's age, family history, smoking, obesity, and hypertension. Again, all things we've talked about already. But there are 2 different types of macular degeneration. We have the wet form and the dry form. The wet form has treatment with injection, and then the dry form has no treatment. But your ophthalmologist or optometrist might have some specific recommendations on vitamins or preventative measures, some that we talked about like sunglass use or diet. So it's important to check in with them if they have any recommendations for preventative treatment. And then diabetic retinopathy is high blood sugar levels that cause damage to the blood vessels in the retina. And this can affect central and peripheral vision. And so you can have blind spots or, peripheral vision loss. And there are treatment options with this as well. They use, medication to control the diabetes or sugar levels. They use injections or laser surgeries. A lot of folks will have difficulty with reading, driving, mobility, and working. It's kind of across the board. You have these blind spots or hazy spots. And I will say with diabetic retinopathy and glaucoma, there is the option of going completely blind. But with macular degeneration, if that is the only condition you're dealing with, you will never go completely blind, possibly just legally blind, which is a definition, put out by the government, 2200 and the better eye. So it's good to know sometimes the ophthalmologists or optometrists are working so diligently to try to come up with any treatment options, and they kind of forget to explain that, or maybe it didn't settle in because it's a new diagnosis for somebody. But I can tell you it's so important to let the folks know that have macular degeneration that they will not go completely blind. I get questions about that a lot. That's kind of a quick and dirty overview of those four. Get your yearly eye exam.
Yeah, that sounds good. And we kind of touched on this a little bit earlier, but I wanted to ask this question mainly due to the times that we're in, where older individuals are asked to kind of stay home, be socially distant, because of everything that's going on right now. So I wanted to see if you had any tips or advice on how to maintain mental health as well as we age, and especially during this current time. For those that may just be struggling with, as you mentioned earlier, depression, or just not being able to have the social life that they're used to.
And that is one of our challenges here in Kentucky, is depression and mental health issues in seniors. And so a lot of support groups are available in town, and a lot of them used to be in-person situations, and they have now gone virtual. And this is where my recommendation of learn every day and try to embrace technology kind of comes into play, because a lot of these resources and ideas that I've thought of, may not work for everybody because of access to technology. So there is a downfall to that. But the Kentucky Council of Citizens for Low Vision is still holding their support group, and you don't necessarily have to get on with a computer. You can call in to listen, and they often have experts and community partners talking about different topics, and then also just folks that are experiencing low vision where you can get advice and ideas. So support groups can be helpful and handy, and you can still attend. And I think it's important, again, finding a routine and putting that on your schedule and making it something that you do. And I believe their next meeting is on October 6th, just a shout out to that. Along with that, a lot of the, Meals on Wheels programs are still happening. The agencies on aging, YMCAs and senior centers, they're all trying to do different activities, physical and otherwise, virtually or via the TV, cable access. So that's another idea. If you're a member of anything, call in and see what they're offering. Or even if you're not a member, call into the Council on Aging or Area on Aging. Hey, I'm struggling. What do you have to offer? What programs are still available? And I know everyone's going to have a different level of comfort with someone coming to their home, them going out. So you have to be careful there too, and only do what's comfortable to you. But then another neat thing that I found right as the COVID pandemic hit was a match program here in Louisville that I signed up for. It's called Louisville COVID Match Program, and it connects low-risk volunteers with high-risk people in your area. And you can, if you volunteer, you can provide picking up groceries or prescriptions, or just checking in, to make sure that person is doing okay. So that's kind of neat. I haven't been matched with anybody yet, but and I signed up in the early stages, so I think I might need to go on and make sure I'm still on the list. But I think that's kind of neat, and you can maintain social distancing and whatever that person's comfortable with. That I did not find a phone number for that. I just found that online, and I just provided my information, same for anyone looking for help. And I know if you hire, someone to do some of those errands for you, it can cost money, but this way we have volunteers. And I love that that's out there, because one of our struggles is volunteerism. So I love to see that we have this match program. And then just another simple thing that came to my mind is adult coloring books. It kind of keeps your mind on something else. It distracts you maybe from what's going on in the world for a few moments and keeps you focused on something else. You can choose lots of different things to do, go, word find, just keeping your mind fresh, doing something, that's distracting, where your concentration can be focused on something positive or different during the day. And then we already talked about technology and just access to information and social interactions. A lot of my clients' families have been setting them up with either an iPad or an Alexa type device that has a screen on it. And then their family member can kind of manage that device. Of course, they have to have internet access at their home, but the family member can kind of manage the device with their phone or tablet. And then they can still call into them or see them or check in with them daily. A lot of my families have been using cameras so that they can check in with their loved one to make sure they're either taking their meds or they're up and at it for the day. And twofold, those devices also, again, help folks with vision impairment access weather information, emergency information. And the ones with screens will actually read directions and different things for you. So lots of fun technology things to access if you're open to it.
Yeah, that sounds all good. I think the more that, especially now that the weather is so nice out, I think the more people can get out and kind of get away from the news for a few minutes.
Yeah.
I wouldn't recommend anyone sitting in front of the news 12 hours a day. That gets depressing on its own, but yeah, just
absolutely
out and doing what they're able to do, at a safe space and safe distance from others. So
some of my folks have really been, thankful for their audiobooks at this time too, just being able to kind of get lost in a book. Many of my folks tell me they gravitate towards the audiobooks more in the winter time. So if you need help finding that program, it's for anyone with, a disability that struggles reading print or holding a book or dyslexia or anything like that. You can get that audiobook program set up, and that's a way to escape a little bit too.
Awesome. Thank you. Was there anything else that we didn't cover that you wanted to share, or?
I just found a quote that I really liked in just thinking about all these topics, and it is from the World Health Organization, and it said, "Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease." So I just thought that was kind of a great wrap-up of all these things that we talked about, and it really hones into occupational therapy, because we try to treat the whole person, their environment, and do the best. So I thought that kind of wrapped everything up into one little sentence.
Yeah. Health is a little piece of it all, and not just, lack of disease, as you said. So yeah, that was nice. So we probably have people watching who either themselves are in the age group to potentially have low vision, or people who may have family members who are starting to experience low vision. What is the best way to contact you about your services? And then can you give some information about who is eligible for your services and if insurance is accepted and that kind of thing.
So the best way to reach me is by phone. I have a local number. It's 502-509-5475. And I provide services to adults and older adults, really any age that's dealing with a vision impairment. But I will say my most popular population is 65 and older, dealing with the age-related conditions. But I provide services in the home. I come to you or to the person with low vision, which makes it a little bit easier. You don't have to, get out to another doctor's appointment. And my services are covered by Medicare and most private insurances. I'm on par with almost all of them, including Medicaid and Passport. And that's something I can check up front for folks to see what their coverage is for my services. And that I guess is in a nutshell how to get to me. There is a referral required, but that is something I can get from your ophthalmologist or optometrist. So you do have to be followed by one of those professionals as well. I can take care of all of that.
Okay. Well, that sounds perfect. So thank you for sharing all of this information with us today. And we look forward to seeing you in person again soon, whenever that's a possibility. We always enjoy working with you and have heard nothing but good reviews from all of the patients that we have helped to receive your services. So we appreciate all that you do, and thank you for being on here with us today.
Well, thank you for all your support. We couldn't do it without you and as a community. So thank you.
All right. We will see you all later. Hope everyone has a good day.